actually Alexandra, and I'm back again with another So in today's video, as you guys can see from the title, it's gonna kind of be more informative. I'll be explaining you guys what exactly is breast cancer, how you can try prevent it, take precautions, and symptoms. I find it, since it is Pinktober, October for Breast Cancer Awareness Month, I said, why don't I create a video informing people about breast cancer? Because oftentimes I heard about it in high school, and they explain what's breast cancer, but after that no one actually did guest talks or spoke about breast cancer. Everything is now based around the internet and based on what you see. So nowadays you are learning things from the internet, so that's why I choose to make this video. Although it might not seem interested, it's pretty informative, and best that you know how to check your breast for any lumps or anything, and just explain you guys overall what's breast cancer. I may be saying, what's breast cancer? Breast cancer is a disease in which cells in your breast grow out of control. So it is, of course, we have all kind of cancer, but this is in your boobs. And yes, men can also get breast cancer, in case you're breast cancer begins in different parts of your breast. It begins, I believe, the lubies, the duct and connective tissue. I'll insert a picture so you guys can have an understanding. So your lubies will be the little things around your breast here. It can also be other parts of your breast, in case you do not know. And what's lubies? It's the glands that produce milk in your breast. When you get pregnant, milk begins to develop in your breast, so that's your lube. We got the lubies that produce the milk, and now we got the duct that's carry the duct, D-U-C-T. The duct is what carries the milk to the nipple. And then you have your connective tissue, what consists of your fatty tissue, your fibroids, and so on. I have to read this information, analyze it, examine it before actually producing it to you guys. So it's been said that breast cancer mostly develop in your lubies, your duct area. So your lubies, remember, is what produce the milk, and your ducts is what brings the milk to the nipples. We got that. So we have different kind of breast cancer. We have invasive, dual, I can't pronounce this word, carcinoma. That is one of the most common kinds of breast cancer. It's where the cancer cell grow outside the duct, which is what the duct is what pass the milk to the nipple. Also go to other parts of your body. And then we have invasive lubilar, if that's how you pronounce it, the lubilar. So we got the invasive lubular carcinoma. This is where the cancer cells spread from the lubies to the breast tissues that are close. But not only that, this too can also spread to other parts of your body. As I told you guys how breast cancer are formed, and there are two main types of breast cancer. Breast cancer occur when breast cells begin to grow up. Not happen to men, but it is kind of rare that men get breast cancer, but it can also happen to men. But majority of breast cancer is found within older women, also found in younger women also. Based on statistics, Breast cancer mostly occur in older women. However, it can also occur in young women. So now I'm going to tell you guys how to look at symptoms. Look out for symptoms. Sometimes breast cancer is also transferred like generation wide. So say one of your family members suffer from breast cancer, you may be at risk to having breast cancer, but it's not a possibility that you may get it. You're more at risk because a family member of yours have breast cancer, but not all the time it is transferred down to you. So that way it's important to find out your family history so you can go to regular checkup and make sure that everything is well within your body. The reason why I did ask that is that you can be at risk of getting diabetes also. That's why when you go to the hospital, they are always asking you if you have something. If you said no, they will always ask if it's a member of your family have diabetes or cancer or suffer from anyone like any kind of thing. They always ask if a member of your family has whatever fever or been at risk to any of those things, because it's a possibility that you may get it also. How do I know and how do you know you have breast cancer? One, if there's a lump in your breast. That's why they always say feel around your breast to make sure that there are not any lumps in your breast. If there are, it's advised for you to go have it checked out immediately. The moment you identify you have breast cancer is when you should go immediately to the doctor to prevent it from spreading anymore.
Swelling, warmth, redness or darkening of the breasts, dimpling or puckering of the breast skin.
Two is it can be a change within the size of your breast. Of course, one of our boobs are bigger than the other one. Well, majority of us. If that is not
area, check your breasts for the changes including change in your breast size or shape, thickening of the skin in the breast or underarm area.
But if you notice like a sudden change in the size of your breast and you're not on your period or anything, you should just feel around to make sure that everything is okay. And if you're scared or anything, just have it checked out by the doctor. Also be a dimpling or thickening inside your skin.
An itchy, scaly sore or rash on the nipple. Pulling in of your nipple or another part of your breast, or pain in one part.
It can also be a nipple that's turned inverted. That's gonna be kind of weird, but if you notice that, have it checked. It can be a rash on your nipple, eczema, or discharge in your nipples. Just a sudden discharge in your nipple, you should have that checked out, because that's a symptom of breast cancer. Swelling or a lump in the armpit, so that way it'll be like telling you, I can't remember how you actually do, but you have to like check around it, like
under your breasts for the same changes. Also feel for lumps or hardness in this area. Step 3. Next, check your nipples for any discharge or fluid secretion. Nipple discharge may be watery, milky, yellowish, or even tinged with blood, and should be checked immediately.
Now you know the symptoms. What can you do to prevent breast cancer? Limit alcohol. Don't smoke. Control your weight. Put down the chip. Put down the McDonald's. Put down the pizza. It not always have to be towards junk food. It just your intake. Like if you just don't overeat, because then when you get overweight, be in control of your weight. Be physically active. If you have a busy lifestyle, this may be difficult to do because you're so caught up in work that you literally do not have time to go to the gym or anything. But if you're at school or college, you can try go to the gym or try be involved in school activities or something just to keep you active. But however, do not make that distract you from your work. Also, you can avoid exposure to radiation. Stop keeping your phone next to you when you're sleeping. Do not put your phone, just lay your phone on your breast, or just have your phone next to you. Sometimes it's good to put on your phone because all that radiation we getting from constantly texting, being on top of the phone, like that's a lot of radiation our body is taking in, and we're not realizing it because we're so accustomed to being on top of the phone. So that way they say do not sit with your phone next to you, do not be on your phone while it's charging, because all these are now it's up to you as an individual whether you're going to take this precaution or listen to what I said and be cautious of what you're doing, and just be aware. Check your breast. Nothing wrong with just feeling your breast. Make sure have regular checkup to make sure everything is good within your body.
Step 4. Lie down on a firm surface on your back and using slow circular motions, feel your breasts for any kind of lump. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast.
So this is the ending of the video. I hope you guys enjoyed it. I hope I delivered enough information so at least you guys are aware of what breast cancer is and how you can prevent it, and check to see if you have breast cancer. And like and subscribe so you can get alert when I post a new video. And if you haven't seen my previous video, go check it out. That's me pranking my friend at school and telling her that I got jumped. Follow. I gotta shout out someone, but I cannot remember the name, but I'll put their Instagram right there so you can go ahead and follow them. Thank you for watching this video, and see you guys in my next video. Link to my previous video will be in the description box down below. Also be alert because a new video is coming this week. Your girl gonna try to be on it. Love you guys. Thank you for always supporting me, and thank you. Bye.